So where are we with Rashee Rice? Well, we just learned from the Chiefs organization, as well as information from Adam Schefter, that the extent of Rice's injury is still unknown despite getting advanced imaging. Well, the organization is getting additional opinions on his injury, as well as return to play timeline. Well, what does that mean? We were all very concerned about an ACL tear in his knee, but what this points to is likely that he has a partial injury to the ACL, not a complete tear or what we call a strain pattern in the ACL ligament that's seen on the MRI. This is actually one of the greatest challenges we deal with as team physicians and knee surgeons, what to do with a partial ACL tear. The way to really come up with a decision on what to do from Rashee's injury comes down to testing, which includes hands-on his knee to assess stability of the ligament, including both translation as well as rotation. But this may be difficult to assess given the likely swelling and guarding that ensues in the knee right after this injury, which was pretty extensive as we saw from the video and from Rice also getting carted off the field. The MRI will also be fully scrutinized and put together with the examination, which will probably show us a partial ACL tear with some of the fibers intact. Typically, some of the fibers of one of the two main bundles, which makes up the ACL, may be torn. However, Rashee could also have other injuries, including a tear of the LCL or lateral collateral ligament, a capsular strain of the knee, a bad bone bruise pattern in the tibia and femur. But these are usually more straightforward than the difficult decision for us as orthopedic surgeons in terms of how to handle a partial ACL sprain. So this is why there is likely a prolonged timeline and need for additional opinions. A partial ACL is not straightforward. It will also be very important to get Rice's personal feedback into his overall treatment strategy. It is still too early to tell, and we will wait confirmation from the team, but this conundrum is now much clearer. The decision will be if Rice truly needs surgery or if he can return to play after this potential partial ACL tear or other partial ligament or capsular injury in just a few weeks. Well, Rashee, we wish you the best of luck in your recovery, and check out all of our updates on this important topic at thepredictors.com. Go!